All right, we are live. It is 6 p.m. Thursday, last day of July 2025. Cannot believe that it's about to be August. It is hot today. Who's with me? Put me a little fire on there if you're feeling it. It is definitely hot. I just finished my, I think, third workout of the day doing HYROX, so I am still cooling off right now. So I had such an overwhelming response to last week's peptide chat. I had no idea that so many people had interest. And I have heard from friends far and near, ones that I haven't heard from in years. So I just thought we should dive a little deeper into this tonight. And I have been, I'm, I think, fielding probably 30, 35 calls a day on peptide questions. So, I am live on YouTube and Facebook and TikTok. So, if you ask me a question and I happen to miss it, I'm sorry. I will try my best to keep up with the feed. But there was a lot of people on last week. I think we had over like 5 or 6 thousand just on. Oh, by the way, my courses are joining me. I don't know if you guys can see that. Eddie, say hi. Let's everybody see Eddie back there. And then Vita's right behind me. So they wanted to come down and join the party tonight and say hi to everybody. So everything's better with dogs, right? Okay, so let's get started. So welcome back to Peptides Unlocked Part 2. So last time the response was crazy. We had so many questions. You had a lot of curiosities about it. Your hunger for healing was, I'm just blown away by it, actually. And that's exactly why we're going to do this again tonight. But before we dive into the science and the stacks, I want to take a second and share something really personal with you. So it seems like just a few months ago, but I guess it started in September of last year, but all of the doctor visits leading up to probably January, February is when the doctors kept saying that I needed knee replacements. And I didn't see just one doctor. I saw two doctors before I ended up at the Andrews Institute and was told by both that I needed a knee replacement. My joints were inflamed, my body was exhausted, and I absolutely was not training. I couldn't train. I could barely walk. I'm like 118 now. I was weighing 158. So I was riddled with inflammation, and I literally thought I was going to just have to start taking all the biologics again that I took in my 20s for my RA because it was so bad. Well, my friend Rob, and I'm sure maybe Rob's on tonight, but he kept pressing me on the peptides, and I was desperate, and I'm sure as many of you are as well. Like if you're feeling terrible and you got tears and maybe needing a replacement. So it was a very humbling time for me. It was so painful. I cannot tell you how many nights I cried myself to sleep, and it forced me to rethink everything. So I did a deep dive into peptides. Fast forward to today, I didn't only avoid surgery, I am training for a HYROX race on October 31st. I'm lifting, I'm rucking, and my recovery is stronger than ever. And peptides are a huge part of that transformation. I'm going to reiterate what I said last week. You have to be willing to change your lifestyle factors if you're going to jump on peptides because they're not cheap. They're not crazy expensive, but they're not cheap. And if you're going to do the investment, invest in yourself and start making some lifestyle changes. If you're not working out, if you're drinking like a fish every night, if you're eating processed foods, do not waste your money. Do not waste your money. You have to start there first. Start with getting some labs, see where you're at, see what's going on with your body. Get to the gym, hire a trainer, start eating right, hire a nutritionist, and then if you want to add peptides to enhance all of those factors, that is when you jump on them. So BPC 157, TB 500, CJC 1295 with ipamorelin, and others helped me heal from the inside out. It isn't just theory, it is super personal for me, and that is why I am bringing peptides into my practice and sharing my knowledge for you and for my patients. So tonight we're going to talk about stacks that work, what women should focus on versus men, how to choose based on your goals, fat loss, healing, hormones, performance, the why behind reconstitution. Bless it. I'm getting so many questions on reconstitution and dosing. So I do have an ebook that I published on my website. If you go to lifewellnessforever.com, you can find it there under the store. And there is a lot of information in that little ebook. I am going to be expanding that as well. I'm working on it. It's my plan next week is to work on that, but my plan is to get that out actually on Amazon so you can buy it. I know a lot of people just like to have a book in hand, so that's what we're going to do. Okay, so I picked 15 questions from this week of what I've received. I've received probably hundreds of questions this week, and I picked the top 15 that seem to keep repeating, because if one has that question, I'm sure a lot of you have the same question. So you deserve to feel strong. I want you to feel vibrant and in control of your healing journey. So whether you're starting out or you're looking to fine tune your stack, this podcast is for you, this live. So before we dive any deeper, I want to give you a quick disclaimer. The peptides that we're discussing tonight are intended for educational and research purposes only. They are not FDA approved to treat, cure, or prevent disease. Always consult with your healthcare provider before starting any new peptide, supplement, or therapy, especially if you have a medical condition or are taking prescription medications. This information is not meant to replace medical advice, but to empower you with knowledge so you can make informed decisions alongside your physician or health team. So, are you ready to dive in? Okay, so let's go over this. And I had somebody ask me at the gym this afternoon, what is a peptide? Because he was having some joint issues and just got a shot at the ortho, and I was telling him now is the time to jump on the peptides, because the steroid will get him feeling better, but he needs to start healing, right? Like, we're not just patching it, but we actually need to start healing. And one of my favorites is the BPC, which is body protection compound. It's one of my favorites for that. But now is the time. If you have an injury, BPC 157 and TB 500 are my two favorite go-tos. So let's go over this. What exactly are peptides, and why are they such a big deal? Peptides are short chains of amino acids, essentially signals that tell your body what to do. Some peptides tell your body to repair, some tell your body to burn fat, others to release growth hormone or improve insulin sensitivity, or even tighten up the gut lining. So I'm actually taking BPC now as I want to say like my probiotic, because I'm eliminating my probiotic and my digestive enzymes, and I'm only doing maintenance of the BPC. I'm loving it. My gut is like the healthiest, stomach's the flattest it's ever been. I don't bloat after I eat. It's been really awesome. They're not synthetic hormones. They're biological messengers, and they're changing the way that we think about healing, performance, and aging. So I want to break down a few of my favorites. All right, so for healing and recovery, BPC 157, which is my personal holy grail. It speeds up recovery of joints, tendons, gut lining, and even the brain. I even have, like, there's so much cancer research about it as well, just on healing the tissues. So always do your homework, but there is tons of information and research studies on BPC 157. Also, I partner it with TB 500. I stack it. It works systemically to reduce inflammation, and it supports muscle and soft tissue repair. So how TB works, I take it about every third day. I take BPC 157 every day. But TB 500, if you're feeling a little achy, your joints are starting to hurt you, you work out, you're not recovering as fast, we're getting older, you think it's just age, that's where TB 500 comes in. I love it. Sorry, I just got through drinking coffee. Okay, so GHK-Cu. I actually just started this on my face as a face serum. I'm not injecting this one, but I'm starting it. It's got like a little blue tint to it. I'll keep you posted, but I started it last night and I am loving it. Okay, just the first night, I felt like everything just went. All right, so it's a copper peptide that supports wound healing, collagen production, skin glow, and even hair regrowth. I had somebody ask me this week about hair. So this is yours. This is the one that you need to research. GHK-Cu. Okay? All right, for fat loss and metabolism. 5 amino, okay? It boosts NAD plus and metabolism. It helps to burn fat without losing muscle. I got quite a few people on the 5 amino that I've suggested to, and they are really liking it a lot, especially if you're dealing with some visceral fat, which is that deep fat that's really hard to get rid of, the unhealthy fat that is suffocating those organs. We have to get rid of that visceral fat. That's where 5 amino comes in at, and it also suppresses appetite. CJC 1295 with ipamorelin is awesome. Hi, Christy Brooks. I see you on. So I started CJC 1295 and ipamorelin about 3 weeks ago into my routine because I wanted to stay lean, especially while I'm training for HYROX, but I want to retain my muscle and keep my booty lifted. And that, I'm telling you guys, it works because I do a shot of it in my stomach, sub-Q, right before I go to the gym in the morning. I'm fasted. And I literally went from lifting, I remember the day I think I was deadlifting or maybe doing some rows for my back, and I had the 60-pound barbell, and immediately I was up to like the 80-pound barbell, and even today I could have lifted the 100-pound barbell. So it works for strength and retaining muscle. So it stimulates growth hormone release in a natural, pulse-like fashion. It supports fat burning. It deepens your sleep and body recomposition. So let me tell you the way that I do this one. And if you guys hear that blowing noise, Jason is outside doing the yard right now. And that's Eddie's like, what is that noise? But he's out there blowing leaves apparently. So I take the CJC 1295 with the ipamorelin in the morning. It's a blend. And I'm not big on blends, but I do like this blend. I take it in the morning. And then in the evening, for repair, recovery, sleep, I take straight up ipamorelin. So I do 20 units in the morning. And again, the units don't matter because it all depends on how much you're reconstituting, okay? So don't even worry about what I'm saying there. But I take it in the morning, the blend, and then at night I take 10 units of straight up ipamorelin, and I am sleeping like a baby. I go to bed exhausted because I am training like no other right now, and I wake up and I'm like ready to go. Okay, so it's working. Tesamorelin is another great one. It's used for visceral fat, especially in men, and cognitive function. It's a little pricier, but I'm hearing phenomenal things. I haven't personally taken it, but I'm hearing phenomenal things on it. All right, so I'm just keeping up with messages as they're coming through. Thank you guys all for being on TikTok. I'm not seeing any messages on YouTube, so if you are messaging me on there, I'm sorry I'm not seeing them. Okay, this is one that I have been listening and reading so much on, epitalin. So has anybody ever heard of epitalin? Okay, it's called the anti-aging peptide. It helps regulate circadian rhythm, improves melatonin, and it actually will extend, they're saying it extends the lifespan. It actually extends the telomeres in your body, and so that is really important for longevity. But I am hearing fantastic things on it. I'm thinking I'm gonna add it to my stack, so I will keep you posted on that. Okay, so we're gonna talk about, for sleep and hormone balance again, CJC and ipamorelin, because of the quality of growth hormone pulses, improves deep sleep cycles. I know a lot of you are telling me that you're not sleeping well, so this is something that you probably need to add in. Kisspeptin 10 helps stimulate natural hormone production, especially in women struggling with perimenopause or post-menopause recovery, okay? For mood, focus, and resilience. We talked about these last week, and I'm hearing so much about them as well. I have not done them, but Selenk and C-Max, Russian neurotropic peptides that reduce anxiety, improve focus, and support mood without stimulants. Somebody's asking me if I can, I guess, give medical advice. No, I'm not giving medical advice. Always see your physician. I am just educating. MOTCC, a mitochondrial peptide that improves energy, endurance, insulin sensitivity, and stress resilience. MOTCC is another one. Also suppresses appetite. Now, let's talk about reconstitution, what it means and why it matters. So when you get the peptides, they come as a powder. It just means that they're freeze-dried. And before you can use them, you have to reconstitute or mix with reconstitution water. I call back water, which keeps the solution sterile and stable. It's about how you store it. And then I refrigerate mine. How much you mix in affects your dose per unit. Too much water, you're injecting larger volumes. Too little, you could dose too high. That's why guidance matters, so you know exactly how many units to draw for your goals. And if all of this sounds exciting but overwhelming, don't worry. I do offer custom peptide consults, and I'd love to help you build a safe, effective plan alongside with your physician based off of whatever your goals are. So if you're watching this on YouTube, just check the notes below, the link to my book, your consult, and you can grab my peptide ebook, and it's right there as well. 55, just lost 115 pounds. Kudos to you for losing 115 pounds and clueless with supplements. Yes, it can absolutely become overwhelming. There's a lot of chatter out there, especially on peptides and supplements. So what I always say is check your labs. See what you're deficient in. I mean, same thing with peptides. I'm able to check labs and see exactly what you're deficient in, so you're just not adding in anything and everything. That is the key. We want to really save your kidneys and your liver and make sure that we're not taxing them by just throwing everything at you in the kitchen sink. So you got to test before, you got to measure. You cannot guess. So don't go at this just guessing. I do have a peptide cheat sheet. So like whatever your goals are, you can look at that and see which ones interest you. We go over that during your consult. But always check your labs. And if you have old labs and you want to send me that, I have a consult for that as well. So let's get to the questions that I had from this week. And then if you guys have any questions that you want me to answer based on this subject, I'm happy to answer them. Hey Jane, thanks for jumping on. Okay, so here we go. What's the best peptide for fat loss without muscle loss? Jessica M. So I'm going to go back to 5-amino. It's one of my go-tos. It supports fat loss by increasing NAD+ and metabolic rate while preserving lean muscle. I love it. Do I need to take a break from peptides? From Mark. Yes, most peptides benefit from cycling. Someone asked me about actually, maybe it was today. They said, why do I need to, some of the peptides suggested dosing is 5 days on, 2 days off. Why would you take 2 days off? It's to keep your receptors responsive. It's like insulin resistance, right? Your body's not sensitive as it needs to be to insulin. So same thing with peptides. We need your body to stay sensitive to it, so those receptors are receiving exactly what you're putting in the body and you're not just becoming immune to it. So I typically recommend 8 to 12 weeks on and then 2 to 4 weeks off, depending on the stack and the goals. Now, some of the ones that I'm taking, like BPC 157, I've stayed on, but I've lowered my dose and I'm doing more of a maintenance. So there is like a maintenance schedule as well. Lori's asking, can I use peptides if I'm on HRT? Absolutely. I was talking about that this week. It actually enhances, if you are on testosterone replacement therapy, TRT or HRT, it enhances that hormone therapy. My girl, Tina Higgins at Premier Hormones over in Gulf Shores, her and I are on the same page with the peptides and hormones. And if you have any questions, I'm happy to refer you over for that. But many women on HRT find that peptides like CJC and ipamorelin, BPC 157, or the GHK-Cu complement hormone therapy beautifully. Do peptides help with perimenopause symptoms? Tanya, yes. CJC 1295 and ipamorelin for sleep and metabolism, and GHK-Cu or epitalin for aging and skin. Kisspeptin 10 can also support hormone rhythm. Chris is asking, how do I know if a peptide is working? Track changes. I always say journal. If a patient or a client comes to me, either for the nutrition or hormones or any of the wellness options that I'm giving them, and we're not really sure what's going on, I always say, hey, give me a journal of like 2 days, like a typical 2 days, not a travel day or anything like that, and just journal every single thing, because when you put it on paper, we can absolutely see what's happening. So track changes in your sleep, body composition, energy, recovery, mood. Many start feeling shifts within 2 to 3 weeks, especially with consistent use. I can tell you, I went from being almost debilitated to 3 weeks later being almost 100%. So if that tells you anything about peptides, I'm just telling you, I am a sole believer in them, and I'm my own guinea pig. Hey Jamie, thank you. Okay, so Chris, just journal everything. So what's the difference between CJC and with DAC and without it? So I'm doing it without it. So with DAC, it stays active longer, often dosed 2 times a week. No DAC is shorter acting and pairs better with ipamorelin for daily use. I just like the daily use. I even switched my NAD to daily use as well, and I'm doing smaller amounts, and it tends to stabilize my energy levels throughout the week instead of like having those peaks and valleys. So again, it's research, right? So you just got to do your own homework. You got to see what works for you. Danny's asking, do I need to refrigerate my peptides? Yes. After reconstitution, peptides must be refrigerated to preserve potency. Before mixing, keep them cool and out of sunlight. Like, I have travel coming up in about 8 weeks, and I'm already stressing about how long my ice packs will last in my carry-on to go hop the pond to Europe and to make sure that they stay cool. So there's lots of travel packs out there too. Like, if travel is on your agenda and you're not sure how you're going to carry your peptides, it can happen. Megan's asked, can peptides help with hair loss? Absolutely. GHK-Cu is amazing for hair regrowth, especially when used topically or with microneedling. Thymosin beta-4 may help as well, so you could stack that. Question 9. Hope, where do you start with peptides? Get labs first. All kinds of issues with absorption, so does that affect dosage? Yes, Hope, it does. So that's why I always suggest labs to see exactly what's going on. If you're having any absorption issues, we need to balance that first before we actually get you on peptides. We probably could start you on BPC 157. That way we're already doing the gut healing as well. Yes, Jamie, looking up insulin carriers. That's what I got before. I can't find it now. I must have loaned it out, so I gotta buy another one. But yes, but I'm thinking mine's gonna be like this big instead of like the little pack. And I'm not sure how I'm gonna carry all my needles without TSA just looking at me all crazy. I'll have to figure that out. Okay, so Bryce is asking, are peptides legal? Yes, when prescribed or purchased legally from trusted compounding pharmacies. But be cautious of unregulated online sources. So that's another thing that you get with me consulting. I have sourced and vetted all of these different compounding pharmacies. They've given me discount codes for my patients, and that way you know when you're ordering them that they're coming from a trusted source. Can peptides be used long-term? From Allison. Many peptides are safe for long-term use with proper cycling and supervision. Think of them like strategic tools in your wellness arsenal. Again, labs, they're everything. Just checking your liver, checking your kidneys, CBC, CMP, checking to make sure that your hormone levels are good, checking to make sure your liver is good. All those things, they matter. So you cannot guess, you have to test. You cannot manage what you're not measuring. Okay, so this is a funny thing. So today, I was listening to a podcast, and I've never heard it pronounced this way, so I'm going to try to pronounce it. So, melanotin. I've been calling it melanotan forever. So yes, that's what I take. That is why I have a tan, and I take one. The reason I started taking it was because it has anti-inflammatory properties. And a bonus of a tan, love it, right? And also it helps prevent skin cancer, which is a plus, but it has melanotan 1 or melanotan, however you want to pronounce it. 1 has a lot more wellness properties to it than melanotan 2. Jason takes melanotan 2. Melanotan 2 actually does have some added benefits for the men. We could talk about that on a whole nother subject, but it does. And there's also PT 141 that is really good as well. All three of them are good. They can be, I would start slow. They are potent. Common side effects might be nausea or moles darkening. Also, your freckles darken first. And use caution and always with medical guidance on the melanotan. But I do love it. It actually does suppress your appetite a little bit too, because sometimes I have to force feed myself because I'm not too hungry. And that is another thing too I want to mention with the CJC 1295 and the ipamorelin. When I do it fasted in the morning, I'm strong in the gym, and I'm fasted for like 16 hours. I'm lifting, and I used to be just famished, like couldn't wait to get home to eat, like was feeling weak. I don't feel that way anymore since I started it. So for whatever it's worth, if you want to give it a try. Josh asked, what's the best time to inject peptides? Most peptides are best taken on an empty stomach, ideally morning and or before bed, depending on what you're using. So I'll also take my NAD shot in the morning because I want the energy. I don't want it to keep me up at night. And I think Rob was telling me that this week that he had a client that took it in the evening and it kept them up all night. So I would take it in the morning if you're taking NAD+. And midday, I might throw in my TB 500 since I'm taking it like every third day. And then at night, I'm taking my BPC 157. And I take the ipamorelin and my melanotan at night. Stephanie asked, can peptides help with joint pain? 100%, yes. Especially like for my RA warriors out there, if you are fighting any type of arthritis, gosh, please research BPC 157 and TB 500. They are such powerful healing agents for joints, tendons, and even old injuries. You know, I was listening to a podcast today. Again, I research from the time I wake up until the time I go to bed, and they were talking about how as we get older and we injure ourselves, like that injury never really goes away, right? Like you'll do something and you'll kind of re-injure it again. I'm telling you, if you add in BPC 157 and TB 500, your body will start healing. It's so important as we age. Okay, we're getting close to the end of my questions. Carlos asked, what do I mix peptides with? So you use reconstitution water, never plain water or saline unless specifically advised. This ensures stability and safety. Last question that I got from this week, what if I'm scared of needles? I have a patient, and I'm not going to call you by name. He's a guy though. And he's like, please give me anything else. Please suggest anything else besides needles, because he doesn't like needles. So I got him a nasal spray today. And so, yes, there are, you're not alone if you don't like needles. There are nasal sprays, there are oral options for some peptides, and honestly, insulin needles are so tiny, you don't even feel them. But I get it. Some people just don't like them. So, I don't see any more questions, and I am trying for all of my ADHD and ADD people out there, I am trying to keep these short and sweet to under 30 minutes, and I think I'm over at like 31 minutes right now. So I am going to cut it, but if you have any questions, reach out to me, Cindy at drcindyross.com. Go to my website, lifewellnessforever.com. I'm happy to answer any questions. If you want to do a consult, I will send you the link. My Peptide Unlocked link to the ebook is in the show notes, and this will also be on Apple Podcast as well. So I always appreciate you guys so much for tuning in, especially on a Thursday evening when you're tired and you've worked all day, and you're you're here with me. So I appreciate you. Everybody on YouTube and Facebook and TikTok, I hope you guys have a great night. Bye-bye.